Hello guys, today we are in unit 3rd, that is assessment and management of pregnancy in antenatal period. Antenatal period in the sense period of pregnancy before delivery, that is antenatal. And 3rd unit, 4th unit combined we get 17 marks. One question for 10 marks, one question for 5 marks and one question for 2 marks. If you complete 3rd and 4th unit, you will get 17 marks. What is normal pregnancy or pregnancy? It is a state of dynamic physiological adaptation to meet the demand of a developing fetus, childbirth and lactation. See, pregnancy is a stage or the state in which the woman undergoes changes in dynamic way. Dynamic way in the sense in all the factors like physically, mentally, emotionally. In all the way she undergoes changes, that is dynamic. And physiological adaptation. Physiological adaptation in the sense physical changes. During pregnancy, women's body is changed. That is physical adaptation to meet, why her body is changing? To meet the demands of what? Developing fetus, childbirth and lactation. Fetus is grown in her womb, so her stomach is enlarged. Childbirth, her birth canal is also enlarged. And lactation, even her breast is also grown a bit. These changes are generally seen in the pregnant women, and this is known as normal pregnancy or pregnancy. This pregnancy period is around 9 months. In other way, it is 40 weeks. If the baby is born at the end of the 9th month, then the baby is considered to be full-term baby. If the baby is born before 9 months, that is around 7th month, in the mid of the 7th and 8th month, if the baby is born before the 9 months, then the baby is considered to be the preterm baby. Now, this pregnancy is actually divided into 3 stages or 3 phases based on the trimesters. There are 3 trimesters. First trimesters, second trimesters and third trimesters. In first trimester, considers the period from conception to 12th week. From the conception, that is from the pregnancy to the 12th week, it is considered to be first phase or first trimester. And from the 13th week to the 28th week, it is considered second trimester. From the 29th week and to the delivery or 40 week, it is considered to be third trimester. Now let's see what are the physiological changes during pregnancy. Physiological changes in the sense physical changes. Physical changes are seen in these sectors, that is reproductive system, cardiovascular system, blood volume, respiratory tract, urinary system, GI system, skin change, endocrine system, psychological system. These are the changes seen, and let's see this in the brief way. The first system is reproductive system. In that, the first is uterus. Changes occurs in uterus during pregnancy. First, the weight of the uterus is 50 grams, but during the pregnancy from 15 grams it becomes 1000 grams. That is, the weight of the uterus is increased 20 times from the normal value because it is bearing the baby. Next, the volume. The volume of the uterus is around 5 liters because it carries the baby and the amniotic fluid, so the volume of the uterus is around 5 liters. Next, the shape of the uterus. At the very beginning stage, the uterus shape is like this. This is elongated, and from elongated it becomes a bit oval. That is around 2 months it becomes oval, and at the mid gestation, that is around 5th and 6th month, it becomes round, and again it becomes oval, and again to the elongated shape. Next, the muscle layer of the uterus. The uterus has 3 muscles, that is the outer layer is known as longitude layer, the middle layer is known as vascular layer, the inner layer is known as circular layer, and these layers undergo hypoplasia and hypertrophy, that is increasing in number of cells, increasing in the size of the cell. Next, it's very important, the length, breadth and thickness of the uterus. The length of the uterus is normally 7.5 centimeter, but it increases to 35 centimeter. The breadth of the uterus is normally 5 centimeter, it increases to 22.5 centimeter. The thickness of the uterus is normally 2.5 centimeter, but it increases to 20 centimeter. These are the changes that is occurred in the uterus during pregnancy. Next is cervix. In cervix, the common sign is Goodell sign. This is nothing but the softening of the cervix. The cervix is the way where the baby passes out. So this way is softened than the normal thing. Next, the length. The length is doubled. Than the normal length, it is doubled. Next, we have vagina. In vagina, the common sign is Chadwick sign. Chadwick sign is nothing but pink, purple, blue discoloration. Either pink or purple blue color is discolored around the vagina. That is Chadwick sign. And next, the secretion which is seen in the vagina is more acidic than the normal. Next, ovaries and fallopian tube. In fallopian tube, we can see hypertropia, that is increase in the size. This normal cells, but at this condition, the cells become like this. This is the normal shape of the cell, but at this condition, at the time of pregnancy, the fallopian tubes becomes, cells gets enlarged. And next, ovaries. There is no ovulation, no menstruation at the time of pregnancies. It is because of the, mainly this one, increased level of estrogen and progesterone. Due to the FSH hormone will be active. Because of this FSH hormone, there is increased in estrogen and progesterone. If this both hormones are in increased level, menstruation doesn't occur. If suddenly this estrogen and progesterone level falls down, gets decreased, then menstruation occurs. Next, breast. Around 16th week, that is second trimester, in the middle of the second trimester, we can see the yellow color discolored around the breast. This is because of the colostrum. Colostrum is secreted, because of that there is yellowish color discolored around the breast. Montgomery tubercles, this is nothing but the pigmentation of areola. This Montgomery tubercles is known to be primary Montgomery tubercles at the first trimester. That is from the conception to the 12th week. It is in the primary stage, primary Montgomery tubercles. After completing 12th week, that is from 13th week, this primary Montgomery tubercles starts getting developed and goes to the secondary Montgomery tubercles. This is nothing but the pigmentation of areola. Weight gained during pregnancy. During pregnancy, until 20 weeks, women will gain only 2 kgs. But after 20 weeks, women will start gain 500 grams per week. In short, per 2 weeks, she will gain 1 kg. At the end of the pregnancy, she will be gaining 12 kgs. For example, if the woman is 50 kgs, by the end of the pregnancy, she will be 62 kgs. Now, in which sector the weight is gained? There are 2 types. That is reproductive weight gain, net maternal weight gain. This is within the womb. This is outside the womb. In reproductive weight gain, the fetus which is in the uterus is around 3.3 kgs. The uterus itself 900 grams. The uterus is enlarged, so it is gaining weight. Within the uterus, we have placenta also, which is 600 grams. And liquor is nothing but amniotic fluid, which is 800 grams. And breast also gains weight, that is 400 grams. And outside the uterus, that is in the maternal body, in the mother body, the blood volume is increasing 1.3 kgs in the mother. It's because the blood is supplied to the baby. So the blood is produced more and the blood leads to weight gain, that is 1.3 kgs. Extracellular fluids. Other fluids also has been secreted in the body and that is also leading to 1.2 kgs. Fat and protein deposit is also seen and that leads to 3.5 kgs gaining in the mother's body. This all together leads to 12 kgs. This completes your reproductive system. Now, cardiovascular system. In cardiovascular system, heart position is changed. Heart is moved upwards and bit towards left in the pregnant woman. Normally, if the heart is present here, in pregnant woman, it's moved bit up and bit left. In the sense, the heart will be moving in this way. And the size of the heart is also increased 12%. And the heart's capacity, that is cardiac capacity, that is working capacity of the heart, will be increasing 70 to 80 ml. In the sense, per beat heart will be releasing 70 to 80 ml of blood more from the normal value. Because of this cardiac capacity, cardiac output will also increase by 30 to 40%. Hypertropia. The size of the heart is increased because of this hypertropia. Hypertropia is nothing but increase in the size of the cell. If normal cell is this way, then the size of the cell will be increasing this way. And that is how heart is increased in 12%. Heart rate will be increasing because heart's capacity and heart output is also increased. So heart rate will be increasing. Even though heart rate is increased, there will be no change in systolic BP. But maybe there is a change at the end of the pregnancy, but not at the beginning of the pregnancy. There is no change in the systolic BP. But whereas in diastolic BP at the beginning of the pregnancy, there will be decrease at around 5 to 10 mmHg. There will be decreased. But around second trimesters or around end of the pregnancy, there will be increase of the diastolic BP. This is about cardiovascular system. Next, blood volume. The blood value in the women will be increasing more at the pregnancy time because the blood which is produced in our body will be supplied to the fetus as well. So the blood value will be increasing. There is an increase for extra blood flow to the uterus. The blood value is increased because there is an extra blood flow where the blood is flowing to the uterus because in uterus the baby is present. And there is a chance of hemodilation. Hemodilation is nothing but the volume of the blood will be more, but the hemoglobin present in that blood is less. The blood volume will be more, but in that blood the hemoglobin will be less. And that is nothing but hemodilation. This is also a type of anemic condition. Normally, pregnant women, we advise to intake these supplements like iron and folic acids. This is about blood volume. And next, respiratory system. In respiratory system, normally pregnant women will breathe deeper and faster. And the rib cage is disclosed upwards. In the sense, the rib cage will be moving upwards because the uterus is expanding month by month. So the rib cage which is present like this will be moving like this because of the stomach is expanding this way. Next, hyperventilation. Hyperventilation conditions, like if the woman is exposed to more air, like if she is going in the bike when the wind is more there, or if she is going in bus and she is sitting nearby the window seat, then with the flow of the air will be in a high rate. That is known as hyperventilation. If even the window is open and the air is flowing in a very high rate, these are known as hyperventilation. When the woman is exposed to hyperventilation, then the woman feels very uncomfortable, dyspnea and dizziness is seen in the pregnant women. Urinary system. Due to increase in the blood volume, there is also increase in the kidney work. If blood is increased, then automatically kidney work will be increased. So that indicates GFR will be increasing 50%. So when the blood is increased, when the kidney is working more, then the kidney size will also increase. So kidney size is increased by 1 or 1.5 centimeters in length. When the kidney is working more, then the urination frequency will also be increased. And urethra will be elongated and will get wider. Elongated in the sense in the length they will be a bit longer, and in the wider they will get bit wider. And bladder. If the kidney is giving workload, then the bladder will be working and the muscles get weak. So bladder's muscle tone will be decreased. In the sense, bladder's muscle tone will be decreased or getting weak, and there is a chance of getting edematous. Edematous in the sense swelling. This is about urinary system. And next we are going to see the GI system. Now first is cavity. In cavity, that is the oral cavity, the saliva which is secreted is generally more acidic. This more acidic, there is a chance of causing tooth decay. Next, gum. Gum is much sensitive than the normal and there is a chance of swelling and bleeding. And this gum sensitive is also due to the saliva is more acidic. Because of this gum also gets sensitive and there is a chance of swelling and bleeding. And when it comes to stomach and esophagus, there is a vomiting and poor appetite. Poor appetite in the sense the female doesn't feel hungerness. And vomiting sensation is frequently seen. And it is frequently seen in the morning, and that is known as morning sickness. Morning sickness is a common sign and symptom seen in a pregnant woman. Next, digestion. Food passes slowly, in the sense food doesn't digest fastly. Next, gastric reflex and heartburn is seen. The food what they consume, there is a chance of reflecting out. That is nothing but vomiting sensation. Like there is a chance of vomiting, and vomiting sensation is continuously seen, and heartburn is also seen. This is about GI system. Next, we have skin changes. Linea nigra. Linea nigra is nothing but pigmented dark line. There will be a dark line from where to where? That is from umbilicus to symphysis pubis. Symphysis pubis is seen in the pubis pelvic region and umbilicus is the navel place. If this is the pelvic, until here there is a dark line which is seen. Okay, this is umbilicus and this is pelvic. That is linea nigra. Colasma. Colasma is nothing but brownish color, brown color dots or patchy like things that is seen in face and foreheads. Styria gravidarum. Styria gravidarum is nothing but the stretch marks. Stretch marks will be like this lines which is seen in abdomen, thigh and breast. In these areas you can see like this stretch lines. After delivery, these lines get converted into white silver color and then that gets disappeared. Vascular spiders. This marks will be like this dot, and there will be lines like this. It looks like spider. These spider marks are generally red in color and they are seen in face, neck, arm and chest. In these regions, vascular spiders can be seen. In these regions, vascular spiders can be seen. And next, palmar erythema. And this is seen in palms, this region, and it is in red in color. Here there will be red color discoloration that can be seen, and that is palmar erythema. These are the skin changes that can be seen in the pregnant women. Now, endocrine system. In endocrine system, there are three types of hormones that are produced. One is placental hormone, another is maternal endocrine glands, and other is steroidal hormone. Now we are going to see what are the changes that is caused because of these hormones. First, placental hormone. From placental hormone, there are two types of hormones that are produced. One is HCG, that is nothing but human chorionic gonadotropy, and HPL, human placental lactogen. These both hormones are produced, and HCG is useful in the syncytotrophoblast secretes. It is secreted around the placenta. Around the placenta, a layer is produced and that is known as syncytotrophoblast. And this is produced or secreted with the help of HCG hormone. And next, HPL hormone. This is used in the placental secretion. That is helps in secreting the glucose. That's the main function of the HPL. It helps in the secretion of glucose and provides energy in the transporting things. This is placental hormone. In placental hormone, there are two hormones which is produced, HCG and HPL. Okay. Next, we have maternal endocrine gland. In maternal endocrine gland, first we are going to see pituitary gland. Since the baby is growing inside the womb, the pituitary gland is active now. First, the pituitary gland gets enlarged and then it gets compressed. Because of this enlarged and compressed activities, mother gets headache. And next, thyroid gland and parathyroid gland. This both glands will get slightly enlarged, and because of that action there is a chance of getting thyroid for the mother. And because of this, even there is an increase in heart rate. Next hormone, adrenal gland. Adrenal gland is present above the kidney, and this gland will be slightly enlarged, and because of this enlarging there is a chance of increase in workload. Already the workload is increased, and this is also a reason for the increasing in workload. Pancreases. Pancreases at the beginning of the pregnancy will be decreased, but in the size it will be decreased, but after the half of the pregnancy it will be increasing in the size. Because of this decreasing and increasing in the size, there is a chance of getting diabetes mellitus, that is nothing but sugar. There is a chance of getting sugar. Next hormone, that is steroidal hormone. Steroidal hormones are nothing but progesterone and estrogen, and this both will be increased level, and it will be maintained increased level throughout the pregnancy. Once if these two values falls down, then the menstruation occurs. Psychological changes. In psychological changes, we can see them in the three ways. That is first trimester. In first trimester, that is the beginning of the pregnancy, the parents will have, or the women will have, the fear of losing her baby. The fear of losing her baby will be the first psychological changes that is seen in the pregnant women. This is not seen in the every women's, but in most of the women's this is observed. And because of that, there is a sadness, depression, and even they will be unable to sleep well. Sleeping pattern will be disturbed. There will be sadness. They will be depressed because of losing the baby. And this is seen in the first trimester. In second trimester, there will be physical discomfort. Physical discomfort in the sense, day by day, the uterus will be expanding. The baby will be growing. At that time, the bump will be getting out. They'll feel very discomfort, and even they'll feel less attractive. Their self-estimate will be reduced. They'll be worried about their physical appearance. And this is seen in the second trimester. In second trimester, the problems that are seen is physical discomfort, worried about their physical appearance, feeling less attractive or unattractive, and low self-esteem. In third trimester, that is nearing to the labor, the female will be worried about the labor and process of the labor and the pain that is caused in the labor. These are the seen in third trimester. Third trimester, they need extra support. They need extra psychological support. They need support from the family, partner, nurse. Everybody provides them psychological support, and this is seen in the third trimester. In first trimester, there is a fear of losing baby. In second trimester, there is a fear of feeling unattractive. In third trimester, there is the fear of labor. And these are the psychological changes that is seen in the pregnant women. Today's topic, discomforts of pregnancy. During pregnancy, there are few conditions which causes discomfort to the pregnant women. And what are those conditions and what are the nursing care that we can provide for the pregnant women? Let's see it now. The first, the very common one is nausea and vomiting. Nausea and vomiting is seen around 50% of pregnant women. This is also known as morning sickness. It is known as morning sickness because this symptoms is generally seen in the early in the morning, soon after waking up. Soon after waking up, the woman feels like vomiting, or she may vomit even. And soon after consuming the food also, she feels vomiting. This is all because of increased hormone. What are the hormones that is generally increased in the pregnant woman? Those are HCG, estrogen, progesterone. Because of these hormones increasing vigorously, there is a change in her body. And if the woman is suffering from this morning sickness, there are few nursing advices that we can provide to them. Those are, don't stay in empty stomach. Don't allow the women to stay in empty stomach for prolonged time. Advise the patient to eat any kind of snacks which is healthy, and even advise the patient to drink juice, healthy juice, natural juice, not the packet ones. Eat in small amount of meals frequently. Instead of eating large portions at a time, you can advise the patient to consume small amount of portion food in the frequency of time, like 4 to 5 times per day. Instead of eating 3 times a day, she can have consume 4 to 5 times in a day. After waking up, Eat salty food. Yeah. Immediately after waking up, that is in empty stomach, the women should consume any salty item which will reduce the nausea and vomiting sensation. Generally, unbuttered toast is prescribed to the patients or the women. Avoid fatty, greasy and spicy food. This is very important because not just pregnant women, generally and if a person want to be healthy, they should avoid consuming lots of fatty foods, lots of greasy food, that is oily food, and lots of spicy foods should be avoided. Next, constipation. Constipation is due to the hormone progesterone, which is increased in the pregnant women. Due to this hormone, constipation is seen, and this is not seen in all women. And the nursing care that we can provide for them is advise the patient to drink lots of water. Generally, it's 6 to 8 glasses. For in this condition, we can advise them to drink more water too. Eat liquid food and then semi-solid and then solid food. First, advise them to consume liquid food for 2 to 3 times and then move to semi-solid and then solid food. This will avoid constipation. And next, eat veggies and fruits. Advise the patient to stay in the healthy way. Instead of eating lots of meat and lots of non-veg, if they're consuming vegetables and fruits, this will be helpful in reducing the constipation. Drink juices. Advise the patient to drink juice which is healthy, which is natural, not the packet juice, and advise the patient to consume the juice with low sugar. This will help in the control of the insulin. Eat green leaf vegetables. Advise the patient to eat green leaf vegetables because eating green leaves increases the water level in our body, and if the water level is increased, it reduces the constipation. Mild exercise and drink warm water. Mild exercise is generally for the health purpose and warm water must be consumed. Heartburn is generally seen when the woman is not consuming food for prolonged time. The woman gets acidity. Because of that acidity, there is heartburning sensation. And if the woman gets vomit, and because of that vomit also, she has a heartburning sensation. And the general nursing care that we provide for them is avoid sleeping after having meal. Immediately after having meal, just go for an walking. Not for long period. At least for 10 minutes, go for an walking. That will help in digestion and heartburning will be reduced. Avoid eating late at night. Manage to consume the dinner within 8 or 9, not beyond that. If you are going beyond that, it may be not a healthy cycle. Swelling of the feet. Swelling of the feet and ankle is due to the fluid accumulation. For this condition, generally, the nursing care that we provide are not to sit with feet hanging down. When you are sitting in the chair or the table, make sure your feet touches the ground, not hanging. Keep pillow below ankle while sleeping. While sleeping, make sure you keep 1 or 2 pillow below your ankle. This will reduce the swelling or will avoid the condition. Next, leg cramps. Leg cramps is nothing but leg pain. This is generally seen in the night time while sleeping. This is because of reduced calcium level and vitamin B1. And generally it is because of the carrying the baby, the women legs get weighter. Like while carrying the baby, the womb is getting big and the leg of the mother is bearing the weight of baby as well as herself. So there is a pressure of uterus on leg nerves. Because of these 3 conditions, leg cramp is seen. This leg cramps can be reduced by following few advices. Those are like provide calcium and vitamin B supplements. Provide them this, and increasing in these levels can help in reducing the leg cramps. Before sleeping, massage the leg with using the warm water. Okay. While bathing or before going to sleep, use a wet towel which is dipped in the warm water and then apply on your leg. Even this reduces, or do massage with using some oils. This may reduce the leg cramps. Next, insomnia. Insomnia is nothing but sleep disturbance. Sleep disturbance in the sense lack of sleep due to discomfort position. When the uterus is growing, expanding day by day, the physical comfort will be getting reduced. So uncomfortable positions may be. The female may not feel comfortable while sleeping. Fetal movements can be seen. Because of that thing, female is unable to sleep. And frequency of maturation. Frequency of maturation is a common sign and symptom, and because of this, the woman is unable to sleep. These are the 3 conditions that leads to insomnia, and there are few advices that can be controlling. Take a glass of warm milk before going to bed. Before going to bed, if you take the warm water, it will help in getting the sleep. Take rest in afternoon. Instead of sleeping just in night time, do take 2 hours of short nap in the afternoon time. Supportive pillows. Use supportive pillows for comfortable position. Do yoga and meditation. This will help in providing comfortable sleep. And there are some other discomforts like dyspnea, fatigue, frequency of urination, backache. There are many discomforts, but generally these are the discomforts and the nursing care that are provided to them. Diagnosis of pregnancy. This diagnosis of pregnancy is actually based on trimester. This trimester is actually divided into 3 types, and each 3 part has its own subjective and objective data. Well, first trimester is nothing but from the conception till the 12th week. From the conception till the 12th week, that is considered as first trimester, that is nothing but first 3 months. And here subjective data, that is nothing but what does patient say. And this is objective data, that is nothing but what that science says. From the conception till the 3 months, at this period, women has few complaints. Those are amenorrhea, morning sickness, frequency of maturation, breast discomfort. Amenorrhea is nothing but absence of menstruation. Women will not get her menstruation. Morning sickness. Morning sickness is nothing but she feels nausea and vomiting at the early in the morning, at the empty stomach. That is morning sickness. It is due to the increase of hormones. Frequency of maturation. Frequency of maturation is nothing but frequency of urination. Next, breast discomfort. Breast discomfort is due to the enlargement of the breast. These are the complaints where female says, generally from conception to the 12th week, that is in 3 months. These are the complaints where the pregnant woman sees. Objective data. What the science says. First, breast changes. In breast changes, we can see breast enlargement. Breast generally becomes bigger in size. That gets enlarged. And there is a pigment of areola. Areola get pigmented. Around areola, the dark color becomes darker. Yellow secretion. Yellow secretion is seen because of accumulation of cholesterol. Next, there are changes in pelvic. In pelvic, the first change is nothing but Jacomer sign or Chadwick sign. Around vagina, you can see there is a dusky color or bit brownish color discoloration is seen. And that sign and symptom is called as Jacomer sign or Chadwick sign. Vaginal sign is nothing but vagina becomes softer. And this sign is seen around the 6th week. From the pregnancy, around 6th week, you can see the vagina becomes much softer than the before. Next, Osender sign. Osender signs is nothing but you can see pulsation. You can hear a beat around vagina. In vaginal wall, you can hear a beat. You can see a pulsation, and that is nothing but Osender sign. Next, cervical sign or Goodell sign. This is nothing but softening of cervix, and this is also seen around 6th week. Next, uterine sign. Uterine signs are nothing but there is an increase in size, softening and elastic. The uterus which carries the baby, that keeps on increasing its size month after month, and it becomes softer, and even it is elastic. It is elastic, and because of that feature, this uterus is being expanded every month. Next, Hegel sign. And this is softening of a region that is between the cervix and the uterus. Between the cervix and the uterus, there is a region, there is a connection, and that parts become softer, and that is nothing but Hegel sign. In pelvic, we can see Jacomer sign or Chadwick sign. That is nothing but discoloration around the vagina. Vaginal sign, softening of the vagina. Osender sign, there is a pulsation around the vagina. Cervix sign or Goodell sign, softening of the cervix. Uterine sign, that is increase of the uterus And elasticity and softening of the uterus, Hager sign. This is nothing but the softening of the region between the uterus and the cervix. These are the signs that are seen in the pelvic. Diagnosis of pregnancy in second trimester. Second trimester includes 13 to 28 week. This is nothing but from 3rd month to 6th month. It also includes subjective and objective data. Subjective data is nothing but the sign and symptoms that is expressed by the patient. The complaints that we receive from the patient is considered as subjective, and the complaints or the sign and symptoms that is present in these 3 months according to science, according to OBG, is known as objective. Subjectively, we can see 3 things, that is amenorrhea, uterus enlargement, quickening. Amenorrhea is nothing but the absence of menstruation, and uterus enlargement is visibly seen in these 3 months, that is from the 3rd month to 6th month. We can see uterus enlargement. And quickening. Quickening is nothing but the fetal activity. Sudden fetal activities can be seen, can be observed. By placing your arm on the womb, you can feel the fetus movement. If the mother is premigravida, premi means first time. Gravida means pregnant. If the mother is first time pregnant, this is her first pregnancy, then the quickening will be felt at 18th week. Multigravida in the sense, if the mother has already a child, this is a 2nd or 3rd pregnancy, then the quickening is seen around 16th week. For premigravida, it is around 18th week. For multigravida, it is around 16th week. Now, objective. In objective, first is chloasma. Chloasma is nothing but the pigmentation that is around the face. In faces, there are some patchy like pigmentations that is kind of brownish in color or reddish in color. You can see around the head and forehead. Next, secondary areola. Secondary areola in the sense, in first trimester you can see there is a pigmentation around the areola. That pigmentation keeps spreading. There is another circle of pigmentation, and this pigmentation is known as secondary areola. Linea nigra. Linea nigra is nothing but the line mark or the stretch mark that is found from the umbilical to the symphysis pubis. This you can see in the skin changes. Braxton Hicks contraction. Braxton Hicks contraction is nothing but irregular or infrequent or painless contraction which is felt in the mother. Once it may last for 20 seconds, once it may last for 10 seconds. So it doesn't have any correct frequency, it doesn't have any time, and it is painless. If you place your arm, you can actually feel the contraction, and this is also known as false labor pain or false labor contraction. Next, fetal movement. Fetal movement is nothing but this is quickening. In science, we say it as fetal movement. Fetal movement you can feel by placing your arm on the uterus laterally. Abdominal change. Abdominal change is nothing but uterus enlargement. How the uterus is being enlarged, in which week, at what stage the uterus is enlarged, we are going to see here. In 16th week, the uterus will be present in between symphysis pubis and umbilical. And this is umbilical, this is symphysis pubis. In this between, that is, in 16th week, the uterus will be expanded this length. And in the 20th week, the uterus will be expanded and it will be present just below the umbilicals. Just below the umbilical, then the distance between this is 2.5. In 20 week, the uterus will be expanded just below the umbilical in the distance of 2.5 centimeter. And at the 24th week, the uterus will be exactly at the umbilical level. If there is a question like at which week the uterus is expanded exactly to the umbilical level, that is 24th week. And next the 28th week. At the 28th week, the level of uterus is above the umbilicus. See, this is 28th week and this is umbilicus. This is above the umbilicus. So, at the 28th week, the uterus will be expanded above the umbilicus. And in these conditions and in this period, you can actually see 2 types of sounds. While examining, you can find 2 types of sounds. One is uterine sound and other is fetal sound. In the diagnosis of pregnancy, it is 3rd trimester. 3rd trimester is from 29th week to 40th week. That is from 6th month to 9th month. This 3 month is 3rd trimester. And it also considers subjective data and objective data, or subjective sign and symptoms, objective sign and symptoms. In subjective, you can see amenorrhea, enlargement of abdomen, edema on feet, fetal movement, lightening. You probably know all these symptoms except this lightening. Let me explain once again. Amenorrhea is nothing but the absence of menstruation, enlargement of abdomen, that is uterus keeping enlarged, edema on the feet. This is also known as pressure symptom. The feet become swollen. This pressure symptom is because of lightening. Lightening is nothing but the moving of fetus towards downwards, towards pelvic, is known as lightening. That is, throughout the period, that is throughout the 9 months, the woman will be carrying the baby. She will be carrying it and she will be bearing the weight of the baby. That is 1 week before the delivery, the fetus moves downwards towards the pelvic, towards the vaginal canal. That is known as lightening. Lightening in the sense, mother doesn't feel the weight of the baby. The baby moves downwards. That is lightening, and because of it moving downwards around the 9th month, the mother's feet is swollen, and that is nothing but pressure symptom. Next, fetal movement. Fetal movement can be commonly seen. Objective data, first we have skin changes. Skin changes in the sense the chloasma, that is pigmentation on the face, and linea nigra, that is lining on the abdomen, and other stretch marks. This all can be seen in the 3rd trimester. And then uterine shape. Uterine shape will be cylindrical in shape throughout the pregnancy, and at the time of delivery it becomes spherical. That shape of the uterus gets changed. Okay. Change in fundus height. Yeah. Month after month, the baby will be growing, the uterus will be expanding, and there will be change in the fundus. Fundus is nothing but the tip of the uterus is called as fundus and keeps on growing month of month, and there is a change in the height. Well, in this also we can see 3 changes, that is 32nd week, 36th week, 40 week. In these 3 weeks we can see the changes. On weeks goes on, the height of the fundus is also increasing week after week. Okay. But if you observe here, at the 32nd week, the fundus height is just below the rib cage. At the 36th week, it's at the rib cage. But at the 40 week, it's actually decreasing its fundus height. It's because 40 is the last week of the pregnancy, and this is the week where the delivery occurs. So, this is the place where the lightening occurs. What is lightening? Lightening is nothing but engagement of the baby's head. That is, baby moves downwards towards the birth canal, and the baby gets prepared for delivery process. Every month baby keeps on growing like this, but at the time of delivery, baby just moves 1 step downwards. So this is why at the 40 week, the height of the fundus is actually decreased. Braxton's Hicks contraction is nothing but the irregular painless contraction. And then USG, it is performed for the estimation of the fetal movement. These are the tests that are performed in the hospital to confirm the pregnancy. Those are urinary immunological test, slide test, kit test, biological test, USG. Is signs of pregnancy. Signs of pregnancy is actually divided into 3, that is preconceptive, probable sign, and positive sign. First, what is preconceptive sign? Preconceptive sign is nothing but the subjective data. The subjective data is what the complaint that we receive from the patient. At the time of pregnancy, patient do experience some kind of signs and symptoms like vomiting, nausea and all, and those complaints are nothing but preconceptive signs. Next, what is probable sign? When the patient comes to hospital, doctor do examine the patient, right? So at the time of examination, if the doctor sees any kind of sign and symptoms, those sign and symptoms are considered to be the probable sign. So probable sign is nothing but the sign and symptoms that is examined by the doctor or the nurse. And this is known as objective data or objective sign and symptoms. Next, positive sign. Positive sign is nothing but the sign and symptoms which indicates the fetal which is growing in the womb is healthy. Now first let's see the preconceptive sign, that is the complaints or the sign and symptoms that we receive from the mother at the time of pregnancy. In the time of pregnancies, all the women almost, they complain about amenorrhea. What is amenorrhea? That is nothing but the absence of menstruation. Next, nausea and vomiting. Nausea and vomiting is generally seen in 50% of women. And nausea and vomiting is generally felt at the early in the morning, that is soon after waking up. Mother do feel like vomiting, and that is also known as morning sickness. Next, enlargement of breast. Enlargement of breast is seen because after the birth of the baby, mother need to feed the baby. So enlargement of breast is seen. Increased urination. Increased urination is because when the baby is growing in the womb, the pressure on the bladder will be more. When the pressure on the bladder is more, then the urination will be frequently seen. That is increased urination. Next, fatigue and thylism. What is thylism? That is nothing but the saliva in the mouth is overproduced. Generally at the time of pregnancy, you might be heard of these complaints like the mother generally feels like eating some kind of sour items like tamarind or some kind of mango. The mother do feel like eating some kind of sour items. It's because of this thylism. This is nothing but overproduction of saliva in the mouth. Montgomery tuberous growth, stretch mark, quickening. Okay, quickening is nothing but sudden fetal activity. If you place your hand on the womb in the second trimester, then you can feel this quickening. That is nothing but the fetal movement can be felt. Next, Chadwick sign. What is Chadwick sign? If you see the diagnosis of pregnancy, you will come to know what is Chadwick sign. That is nothing but the discoloration around the vagina. Colostrum from breast. Colostrum formation is also can be seen here. The probable sign. Probable sign is nothing but the sign and symptoms that is observed by the doctor at the time of examination. So what are the symptoms that doctor generally sees? Change in uterus. Uterus level will be changing month after month. Goodell sign. What is Goodell sign? Goodell sign is nothing but softening of the cervix. Braxton Hicks contraction. What is Braxton Hicks contraction? That is nothing but the irregular and infrequent and painless contraction. That is also known as false labor pain. Positive pregnancy test. When you are taking pregnancy test in the hospital, generally that comes positive because they are pregnant. And still there are many signs and symptoms generally can be seen like vaginal sign, uterine sign, Osender sign, Heger sign, and many more. If you see the diagnosis of the pregnancy, you'll get an idea about this. Before watching this video, please do watch diagnosis of pregnancy. Next, positive sign. What are positive signs? These are the signs that indicate that the baby is in the healthy way. The pregnancy is going in the healthy way. Okay, when you go to an hospital, doctor do examine you. At that time, there will be lots of examinations going on. And positive sign can be the result of those examinations. Like, what are the fetal heart rate? What are the fetal sound? What is the fetal heart tones? How the fetal is present in the womb? And how the fetal skeleton is visible in the X-ray, and what is ultrasound result. Is there any other deformities? Everything can be identified, and those comes under positive signs. Antenatal care. What is antenatal care? Antenatal care is a care that is provided to the antenatal mother. Well, the antenatal period is nothing but it is the period of pregnancy, that is from the date of conception, that is from the date of the pregnancy till the date of delivery. This period is known as antenatal period, and antenatal care is the care which is provided to those women who are pregnant. And this antenatal care is also known as prenatal care. Now, the objectives of antenatal care. Objectives are nothing but the aims and the goals of the antenatal care. The main aim is nothing but to promote the health of the mother and the fetus. Now let's see what are the objectives. First, to assist the health status of the mother and fetus. The very first thing is when the mother come for a checkup, we will see whether the mother is healthy or not. If we come to know the mother is not healthy, if the mother has any kind of illness, then we need to promote and maintain the health status. Next, Regular screening should be done. Regularly we should screen whether the fetus heartbeat is normal or not, whether the fetal movement is normal or not. So we need to keep on screening regularly at the regular checkups. And if we find any kind of illness, we need to prevent it and treat it before it gets complicated. Next, we need to orient the mother with physiological of pregnancy and labor. That is, month after month, the mother's body will be changing. The womb will be getting bigger and bigger, and because of that, mother will be feeling very insecure. She will lose her self-estimate. To regain that, we need to encourage her. To regain it, we need to educate her about the physiological changes that occurs during the pregnancy and during the labor. But when you orient, there may be anxiety and fear in the mother. We can find it. If we find it, we need to reduce it. We need to remove it by educating the mother. We need to provide an psychological support by which the mother will be able to regain her confidence. Next, by performing all those actions, we will be able to reduce the mother and infant morbidity and mortality rate. What is morbidity and mortality rate? That is nothing but death and disease rate. We need to discuss with the patient about the time, place and mode of delivery. That is nothing but when the patient comes to hospital, we will come to know LMP. What is LMP? That is nothing but last menstrual period. So when was her last menstrual occurs? By that we will come to know the EDD. What is EDD? Expected delivery date. By LMP we will come to know when the delivery might occur. We will inform that to the patient and the couple. By that they will come to know the time, place and mode of delivery. Motivate the couple about the need of family planning. Family planning, we need to motivate them, and most importantly we need to motivate them for spacing. Spacing is nothing but there should be at least 2 years of distance between two children. Like if the first child was born in 2000, then the next child should be born at 2002. There should be 2 years difference. That is spacing, and that should be motivated. We need to provide education about it. And we have to inform the patient, the mother, to come regularly for the checkup. And the main checkups are at the 10th week, 18th week, 24th week, 30th week and 36th week. These are the 5 main checkups that are present in antenatal care. Now you need to understand few terms. Those are LMP, EDD. What is LMP? That is nothing but last menstrual period. EDD is nothing but expected delivery date or estimated date of delivery or estimated due date. LMP is the date when the woman got her menses lastly. That is, which was the last date when she got her period. That is LMP. And EDD is nothing but at what date the woman may get her delivery pain. Based on the LMP, we will calculate at which date she may get her delivery pain, at which date she may expect the baby. Okay. To calculate this EDD, we have to know the LMP. Okay. Naegele's formula. Naegele's formula, there are actually 2 ways to calculate EDD. Those are, first we need to get to know LMP. Let's assume any date like 5/3/2022. Okay. This was the LMP for a girl. Okay. This is 5/3/2022. This was her last menstrual period. Now when will be her EDD? That is expected delivery date. When will be her EDD? That is calculated by a formula. That is, first we need to have 7 days. First we need to add 7 days for this day. And for month we need to subtract 3. This is the formula. This is the first formula. That is, first we need to add 7 for the day. For the day we need to add 7. For month we need to subtract 3. This is the first formula. This is the day, that is 5. We are adding 7. 5 plus 7, that is 12. Next, from 3 you need to subtract 3. Okay. In 3 if you subtract 3, that is 0. So you can't write 0 here. Okay. So, third month is nothing but March, February, January. Before January we have December. So, in 3 if you subtract 3, you will get December. Okay. You need to write 12 here, not 0. If you subtract 3 from 3, you can't write 0. You have to write 12. That is, March, February, January. Before January, that is back of the January, we have December. We need to write 12 here. The same month. You can't go back. You are going backwards. This doesn't mean you have to write 2021. You have to write 2022 only. If the woman is pregnant today, she will give birth after 9 months. She can't give birth before 9 months. Okay. So you can't write 21 here. You have to write 22 only. See, if a woman is pregnant in 3rd month, she will get her baby. She will get her delivery around 12th month. There is another formula that is with the same date. Let me perform it. In this, we need to add 7 days and add 9 for the month. In this, for days, we need to add 7, and for month, we need to add 9. Okay. 5, 7 is nothing but 12, and 3 plus 9 is nothing but 12, and the same year. So this is her expected delivery date. These are the two formulas. In first formula, you will add 7 for the day and subtract 3 from the month. In second formula, you will add 7 from the day and add 9 for the month. If you have any doubt, do comment. I will give another example. Next, we have gestational age. Gestational age is nothing but the period at which she is pregnant. For example, if the woman is 4 months pregnant, then her gestational age is 4 months. Okay, that is the period of pregnancy. Gestational score. Gestational score is nothing but GPLA. This is how you write the score. Here G indicates gravida. What is gravida? Gravida is nothing but number of pregnancy. Number of pregnancy. That is gravida. Gravida indicates number of pregnancy. In this, there are few terms. Premigravida. Premigravida is first time. Premi is first and gravida is pregnancy. Premigravida is a person who is first time pregnancy. If the mother is having the baby for the first time, if the mother is pregnant for the first time, then she is known as premigravida. And there is multigravida, that is if the mother has already undergone delivery and this is a second or third pregnancy, then that is multigravida. Nulligravida. Nulligravida means the woman is not pregnant yet. The woman has never undergone any pregnancy. That is nullgravida. Next, elderly premigravida. Elderly premigravida is, okay, premigravida is first pregnancy. First time the woman is pregnant. Elderly in the sense it is indicating the age. If the woman is more than 30 years old, then that person is indicated as elderly premigravida. If the woman is getting first time pregnant and her age is above 30, then that is known as elderly premigravida. Next we have P. P indicates para. Para is nothing but number of pregnancies ended up at delivery or number of delivery. Para means nothing but delivery. How many deliveries the mother has undergone. That is para. This para has few terms. Premipara, multipara, nullipara. Premipara is the first delivery. Multipara is second and third delivery. Nullipara is no delivery. She has not gone any delivery. And next we have L. L is leaving. A is abortion. Abortion. A is abortion. L is leaving. Let me teach you how to write this score. Okay. Just imagine we have a mother who has already one child. She has one child which is living and she is pregnant now. So it indicates there are two number of pregnancies. She has two children. Okay. One is already born. She is alive. And one is already born and the baby is girl. She is alive. And one is carrying. She is carrying one baby. That indicates number of pregnancies 2. She is 2 times pregnant. Two pregnancies. Para, P. Para is number of delivery. How many deliveries? This is not born yet. This is already born. So, 1 para. L is leaving. How many is leaving? 1 is leaving outside. The inner one is not. The baby which is carrying is not considered. So, the outside one is considered. That is 1 leaving. Abortion. A indicates abortion. There is no abortion. 0. Modalities of diagnosis. Invasion and non-invasion. Here you will see that what are the screening and diagnosis that is done in the time of pregnancy to see the fetal growth and the health of the women. Generally it is two types, that is non-invasive and invasive method. What is non-invasive and invasive method? Invasive method in the sense we generally hurt the patient, like we insert the syringe into their body, or we will do some kind of cutting for collecting the samples. A general example is for collecting blood, we usually insert the needle into the patient's body to collect the sample. So it's a best example for invasive method. For non-invasive method, we have an example like BP. To check a BP, we'll tie the cuff in their hand and then collect the BP counting. This is not painful and there is no insertion, there is no cutting is occurred in this non-invasive method. Now let's see what are the tests that is performed in the time of pregnancy. Non-invasive method generally sees observation or palpation, like examining the woman's uterus from outside the body. Outside the body, they usually palpate or observe and examine how the uterus is growing. Ultrasound detection. Ultrasound detection in the sense we see the fetal movement and growth. Listening to fetal heart sound. Listening to fetal heart sound, and then there is a test like NST and CST. This is used to detect the fetal's heart sound, heartbeat, and how the baby is responding, whether the baby is active or not. This NST and CST is very important. You will see it later in detail. Invasive method. In invasive method, we have chorionic villi sampling. Chorionic villi sampling is done by collecting the chorionic villi. Those sample is collected and this is present in placenta. By this examination, you'll come to know whether the baby is getting enough amount of blood or not, enough amount of nutrition is provided or not, either enough amount of oxygen is supplied or not. By this examination, you'll come to know. Amniocentesis. In amniocentesis, we usually collect amniotic fluid from the mother's womb, that is amniotic sac, and in that we will check whether this amniotic fluid is consisting enough amount of nutrition or not. Next, fetoscopy. Fetoscopy is nothing but, there will be probe which is inserted into the uterus, that is it will be in a rod like shape. It will be inserted into the uterus to observe whether the uterus is in the proper condition or not, whether the uterus has enough blood or not, whether the uterus is healthy or not, is there any damage that can be seen in the embryo. Everything will be observed. This is invasive method. Cardiotocograph. Cardiotocograph is nothing but cardio indicates the heart. Here it indicates the fetal heartbeat. And toco indicates uterine contraction, and graphy is nothing but graphical records. How the fetal heart rate or the rhythm, how the uterine contractions are connected with each other, we will see it in the form of rhythm. In form of graph, we will get the result. And the machine which is used to monitor it is known as cardiotocograph. It is also known as electronic fetal monitor or external fetal monitor. There are actually two methods. Those are NST and CST. First, NST. In NST, first we will provide a mother a comfortable position, that is mainly laterally tilt position, not the supine position. Laterally tilt position is like this. Supine position is if the patient is sleeping straight, that is supine position. Supine position is avoided to avoid supine hypotension. When the mother is sleeping straight, then there is a sudden fall of BP which is known as supine hypotension. So because of that, we avoid supine position, we provide laterally tilt position. At this time of examination, there are two sensors which is placed in the womb. That is, one is above the womb and other is near the pelvic region. There are two sensors that are placed and a button is provided in the mother's hand. We will advise her, when the patient is moving in your stomach, she has to press the button. If the fetus is sleeping, when we are placing the sensor, we will come to know the fetus is not active. So we will advise the patient to wait for 1 hour and then again come for an examination. Again, after 1 hour, when we place the sensor, the fetal beat should be active. If the fetus beat is not active, if the fetus is sleeping still, if the fetus is sleeping more than 1 hour, more than 60 minutes, it indicates the fetus has abnormalities. There is a problem. There is a fetal distress. That is why the baby is sleeping. The normal beat of non-stress test is 110 to 150 beat per minute. This is normal. This examination is performed for 10 to 20 minutes. See, when the examination is performing, that is in 10 to 20 minutes, the mother is advised to press the button when the fetus is moving in the stomach. So at that time, there are at least 2 times the examiner will take the count. In that time, while taking the fetus heartbeat count, the count should not be less than 10 or 15 beats from each other. Like for first time, if we get 120, the second time it should be either 110 or 130. 110 or 130, that will be the normal. If the beat is exceeding more than it or being less than this, then that is abnormal. The advantages of NST are, it's a non-invasive test. There is no cutting or insertion is seen in this examination. This test is very simple, it's not expensive, and the time is also less consumed. That is, within 10 to 20 minutes this examination will be performed. Next, there is no contraindication or complications. After performing this examination, there will be no problem that is seen in the fetus or the mother because of this examination. And no specialist is required for performing this examination. If a person knows how to perform this examination, he is enough to perform this. And the report will be provided immediately. This is not time taking process. These are the advantages of NST. Indications of NST. Which mothers are advised to undergo NST? Those are the women who has medical conditions like diabetes and hypertension or any other medical conditions. They are advised to undergo NST and they are advised to keep screening regularly. And next, if the baby is less active, if the baby is not moving regularly in the interval of times, or if the baby is sleeping, generally we advise them to undergo this examination. And mainly if the baby is small, if the baby is not growing properly, for them also we advise to undergo this examination. And if the amniotic fluid is too less or too more, that is, we'll come to know by observing itself. If the womb is very big, that is, amniotic fluid is more. If the womb is very small compared to the months, then the amniotic fluid is less. Even at that condition, we will advise the mother to undergo NST. And if the mother has lost her baby previously, if the last pregnancy was ended up in abortion, then we will advise the mother to undergo this NST as a precautionary measure to save the next baby. Next, if the delivery is near, if the delivery date that is given is almost near, around 38th, 39th, 40 week, we will advise the mother to undergo NST examination. If the mother has any other complications like breech position or any other examinations like this, collecting any tissues, we will advise the mother to undergo NST first to see the internal environment, to see the baby's condition, whether the baby is healthy or not, and then we will advise the mother to undergo other examinations. This is the indications of NST. Basic terminology in NST. The first is baseline rate. Baseline rate is nothing but the fetal heart rate is in between 110 to 150 beat per minute in 10 to 20 minutes. That is known as baseline rate. That is normal rate. Next, bradycardia. Bradycardia is nothing but decrease in heart rate. Okay, so it indicates the beat per minute. The fetal heart rate is less than 110 beat per minute. That indicates bradycardia. Tachycardia is nothing but more. So if the fetus heart rate is more than 150 beat per minute, it indicates tachycardia. Baseline variation. Baseline variation in the sense how many counts it can vary from first to second beat. It can vary in between 10 to 15 beats per minute. That is, for first time it is 120, then the second time it can be 130 or 110. Okay. Acceleration. Acceleration is nothing but temporarily the fetus heart rate will be increased. While performing this examination, the examiner will take the count at least for twice. While taking the count, if the distance between first and second count is 15 to 10 beats, like 10 to 15 beats, it's okay, it's common. But sometimes, like 1 or 2 times, the fetal heart rate will be increasing more than 15. That is, for first time if you take 120 beats per minute, for second time it will be 140 beats per minute. For some time, at least 1 or 2 times, the beat will be increasing more because of fetus hyperactiveness. That is common. Again, it will become normal. Next, deceleration. It is nothing but a decreased fetal heart rate. That is also temporarily. These symptoms generally can be seen at the time of delivery or when the fetus is moving downwards. Descent is nothing but movement of the baby. That is because of the contraction in the uterus, the fetus will be moving. That is known as descent. And at that time, sometimes the fetus heart rate will be decreased, and that is also temporary. Okay, that is descent. These are the terminologies that are seen in NST. Now, contraction stress test, and this examination is performed around 34th week till the delivery. That is, at the end of the pregnancy, this examination is performed, and it is performed around 34th week. From the 34th week, this examination is performed. And this examination is performed to see whether the baby is able to handle the delivery process. At the end of the delivery, there will be sudden decrease in oxygen level. That is, there will be a sudden decrease in fetal heart rate. You have been heard that deceleration, that is temporary decrease in FHR. It is because of this condition. That is, at the process of delivery, when the baby is moving towards the birth canal, due to contraction, there will be a decreased amount of oxygen supply. When the oxygen supply is decreased, then suddenly the fetal heart rate will also be decreased. This is because of uterine contraction. At this condition, will the baby be able to handle the situation or not? We will see here. And while taking this examination also, the mother will be tilted, laterally tilted, not in supine position. And this examination is performed for 20 to 30 minutes. And in this examination, we will see more than 3 contractions. Just 2 is not enough. We will see more than 3. And each contraction should last more than 40 seconds. If the baby is not moving when the mother is placed in the position, when the mother is ready for the examination and the baby is not moving or the baby is not responding, we will provide some kind of medicines and stimulations to make the baby move. That is, there are 2 types that are provided. To make the baby move, we will provide oxytocin challenge test. That is nothing but we will administrate the oxytocin in the dilution formula in the IV and then wait for 10 minutes, and then automatically the response will be seen. Or else we will apply nipple stimulation. Nipple stimulation is applied, and by that we can see there is a release of oxytocin which will promote the movement of the baby. And then why this contraction test is performed? This is performed to see whether the baby is staying healthy even at the situation when there is a sudden reduce in oxygen level. During the time of contraction, that is during the time of labor, if there is a sudden, during the time of labor, there will be a contraction. At that time, there is a chance of reducing the oxygen level. When the oxygen level is reduced, there will be a sudden fetus heart rate reduced. Will that baby be able to handle it or not? We will see here. And next, is the placenta is healthy or not? Is the placenta is supplying enough amount of blood or not? That also we will see here. In this test, we will see this both thing. Contraindication of CST. Contraindication of CST is nothing but the women who are not allowed to undergo CST. That is, the woman who is having placenta previa. That is a medical condition that is seen in placenta. If a woman has placenta previa, she is not allowed to undergo CST. And the woman is having antepartum hemorrhage. That is nothing but bleeding at the time of pregnancy. Even if she is bleeding, she is not allowed to undergo this examination. And if the woman has undergone C-section, that is, the previous delivery was not normal delivery, it was a C-section, that is, it is a cesarean section, then she is not allowed to undergo CST. And if the woman has a chance of preterm baby in the sense, the baby is born in the middle term, that is, the baby is born at 7 months or 7.5 months, that is known as preterm. The baby is not born at 9 months. The baby is born at 7 or 7.5 months. That is preterm baby. If there is a chance of preterm baby, preterm labor, then the woman is not advised to undergo CST. Basic terms of CST. First, normal CST. This is nothing but when we get the report after the examination of CST, if we get negative, it is normal CST. When there is a decrease in oxygen level, even though there is a decrease in oxygen level, if the heart rate is not reduced, then the report will be negative. But in some conditions, after the pain, after the contraction, the fetal heart rate will get reduced. That is also normal. Next, abnormal CST. Abnormal CST will be positive. That is, when there is an oxygen level decreased is observed, the fetal heart rate will also be decreased. This indicates in further at the time of delivery there will be a problem. Next, hyperstimulation. Hyperstimulation, that is nothing but the contraction, the pain in the uterus that we seen, it should be around 40 seconds. But here we see is it's above 40 seconds, that is 90 seconds or more than that. That is hyperstimulation. Suspicious. Suspicious is nothing but first we see the late deceleration, that is after the end of the pain, after the contraction, we see the fetal heart rate will get reduced, but it is seen only once. And next the repeating pain will never cause the decrease of fetal heart rate. Next, unsatisfactory, that is nothing but while recording in the CST examination, the sound which we hear is not in a quality, that is the sound or the beat is very low, that is nothing but unsatisfactory. These are the basic terms of CST. Antenatal care. In antenatal care we will see preparation. What are the preparation that is undergone in the time of antenatal care? We provide antenatal counseling, antenatal exercise, antenatal diet, educate and prevent substance abuse. If the mother is addicted to smoking or drinking alcohol, or else even in the surrounding, she is not even allowed to stay in the surrounding of smoking and alcoholic surrounding, we will advise the mother to stay away from such surroundings. Education for childbirth. Regarding childbirth, we will provide the education, that is what are the process that is undergone in the childbirth, what are the painful process, what are the methods, everything will be explained. Educate the husband and the family. We will advise the family and the husband to support the mother so that the anxiety level of the mother will be reduced. Preparation for healthy and safe delivery. Healthy, safe delivery is okay, but hygiene delivery is also important. Hospital should maintain the hygiene measures when it comes to the delivery process. Next, prevention from radiation. Yeah, this is given in the form of advice. Mother is advised to stay away from the radiating areas, that is she is not allowed to undergo any x-rays and some other kind of radiation which causes harmful for the baby, so that the mother is advised to stay away from the radiations. These are the things that are seen in the preparation when it comes to antenatal care, and the first three is very important, that is counseling, exercise and diet. We will see these three in detail. First, antenatal counseling. In counseling, these four things are main. First, strengthening the prenatal bonding. Prenatal bonding is nothing but the bonding between the mother and the baby before birth. That is, the baby is in the womb. At that time, mother is connected to the baby. Mother is advised to talk to the baby and baby will respond for that. So, by this method, the baby will be healthy. Overcome anticipatory fear of labor. Generally, every woman has a fear of labor. So, we should speak to them. We should provide the courage to overcome the fear. Next, reduce stress that can negatively impact labor and birth. Stress can impact on the women directly on psychological thoughts. When the stress is increased, the woman's confidence level will be reduced. She will lose her hope. We should speak to her in a courageous way. We should provide that confidence that she can overcome this labor. So we need to reduce the stress. We should provide her a positive impact and reduce the negative thoughts in her. Find one's own individual style for coping with labor pain and choosing the birthing facilities. Not every woman will be okay with one method. There are several methods to reduce the pain, and every woman is special, so every woman will have a different method to overcome the pain. So we should find which method works for the women to reduce the pain and birth facilities. Antenatal exercise. Antenatal exercise is nothing but the exercise that is performed by the women at the time of pregnancy. What are the benefits and the uses of antenatal exercise? See, at the time of pregnancy, if the woman is performing exercise or doing some kind of body stretching activities, it will be helpful for the women to reduce the pain like backache, cramps, hip pains, leg joint pains, everything will be reduced, and the body posture will get improved. It reduces constipation. Constipation is a general problem or the minor problem that is seen in the pregnant women. Exercise will reduce it. And other minor problems like stiffness, body aches, constipations, insomnia can be reduced by doing exercise. And even by doing exercise, our muscles get free and comfortable, and it will get prepared for delivery process. By doing exercise, our stress level and anxiety level will get reduced. If the stress and anxiety level is reduced, then automatically the insomnia which is present in the pregnant woman will be reduced. In the sense, the mother will get a good sleep, a healthy sleep. A healthy sleep indicates a healthy baby. These are the benefits of antenatal exercise. What are the common exercises that are need to be done at the time of antenatal period? That is nothing but abdominal exercise, pelvic floor exercise, circulatory exercise, breathing exercise. See, in abdominal exercise, you can see the transverse exercise, which is quite common. That is, you should get kneeled as shown in the pic, and then you should move your lower part like the abdomen. You should move your leg and spine. That is considered to be the abdominal exercise. And next, pelvic floor. Pelvic floor exercise is one of the main exercises which is done during the antenatal exercise. To support the pregnancy, pelvic floor exercise is very important. In that, Kegel exercise is the common one. You have to first lay on the ground and then lift your abdomen region as shown in this pic, and you have to hold it for at least 10 seconds or 5 seconds is also okay. You have to lift your abdomen by inhaling and then hold it, and then you can get back to the normal position by exhaling. This can be done either morning and night. This is Kegel exercise. Circulatory exercise is nothing but the exercise that is performed to the leg, mainly for the circulation of the blood. Next, breathing exercise. Breathing exercise is nothing but you need to sit straight and breathe in, breathe out slowly by inhaling and exhaling. And you have to do it repeatedly twice or thrice a day. Warning signs or the stop sign. This is nothing but if you see this sign or if you see this condition, you need to stop doing exercise immediately. That is, if you see any vaginal bleeding, if you see any bleeding from the vaginal area, you need to stop doing exercise and consult the doctor. If you feel more fatigued, like if you're feeling like you're almost going to fall on the ground, if you're feeling like that, if you're feeling very dizzy, you need to stop doing exercise and consume more water and other kind of energy drink. And if you have problem in breathing, like shortness of breathing, you need to stop doing exercise. And if you get any chest pain or abdomen pain, you need to stop doing exercise. Headache. If headache is getting worse by doing the exercise, you need to stop it immediately. Muscle weakness, you're not feeling strong, you're feeling very, very weak, then you need to stop doing exercise. Any pain or swelling, at the time of swelling, nobody is going to do exercise, so no need to do exercise. Uterine contraction. If you feel any kind of uterine movements or uterine contraction, you need to take the rest and please don't do the exercise. Decreased fetal movement. Yeah, even if you doesn't feel the regular fetal movement, you are not supposed to do the exercise, because by doing the exercise, you are making the condition more worse. You need to consult the doctor immediately if you're feeling the fetus is not moving as usual. Fluid leaking from the vagina, like either vaginal bleeding or fluid leakage, you should stop doing exercise. You need to visit the doctor. Antenatal diet. Antenatal diet is nothing but the diet that is followed by the woman who is pregnant. That is antenatal diet. And these are the factors that is required by the woman. First, the carbohydrates and fat. The basic function of this both carbohydrates and fat is nothing but to provide energy to our body when our body is in need. It can be when we are in fasting mode or when we are ill, like when we are not feeling well, or when our body is requiring energy. This carbohydrates and fat will get converted into energy and provide energy to our body in the form of glucose. And generally, carbohydrates can be seen in rice, wheat, potato, sugar. These are the common examples. And for fat, if you see, we can see the butter, ghee, vegetable oil, milk, egg. These are the common sources for fat. And next is protein. When it's come to protein, you have to understand folic acid is very, very important with respect to protein. Folic acid is nothing but vitamin B6. Vitamin B6, the other name is folic acid. And folic acid is very, very, very important to activate the protein. When you are consuming protein and you are not consuming the folic acid, the consumption of the protein will be waste. So make sure when you are consuming protein, you are consuming folic acid too, because folic acid is the vitamin which is used to activate the protein. So proteins are generally seen in fish, meat, chicken and other dairy products like milk products. Next, minerals. Minerals is generally consumed in a really minute quantity. The presence of minerals may not lead to a big difference, but when the minerals are not present in our body, that leads to an deficiencies. Like if iron is not present in our body, it leads to anemic condition, and if the calcium is not present in our body, that leads to the disorder that is related to bone, and if folic acid is not present in our body, that leads to the blood related and other conditions, and if vitamins are not present, that leads to the particular disorders. Like if vitamin A is not present, it affects the eyes, and if fiber is not present, that leads to the weakness that is related to the muscles. Now iron is present in beetroot, green leaves and all, and calcium is present in milk products generally, like milk, egg, cheese, curd. Next, folic acid is generally present in the green things like dark green leaves and other green like beans, yeast. Next, vitamins. If the woman is lacking vitamin A, then she is advised to consume carrot. And if the woman is lacking in vitamin B, then she is advised to consume some other seeds, beans, nuts and all. And if the woman is lacking on the vitamin C, then she is advised to consume more fresh fruits and green leaves. And vitamin D, the generally related to calcium, so she is advised to consume lots of milk. And fibers you can find in rice, oats, peas and cereals. These are the sources. This is the basic nutrition things that is required for a pregnant woman. Now, psychosocial and cultural aspects of pregnancy. What are the changes that is related to psychological, or the changes that is related to social, or the changes that is related to culture aspect? What are the aspects that affects the women during the pregnancies? Okay, the first one is adjustment to pregnancy. Adjustment to pregnancy is nothing but during the time of pregnancy, the woman's body will be changing month after the month. Her belly gets expanded, she feel more unattractive, her mood gets swinged, like she feels more depressive once and she feels very happy once and she feels more frightened once. Everything mix of emotions, and there are lots of changes which is seen during the pregnancy. So the very first is the women get psychologically affected because of the change in physical environment and emotional environment. And next is unwedded mother. Unwedded mother is nothing but the women who gets pregnant is not married yet, and they are known as unwedded mothers. The cause behind the unwedded women can be like personal reasons like illegal profession, or maybe cases like raped. Generally at these aspects, these mothers, the women who get pregnant is kept apart from the society, so society treat them in a different way, which affects them psychologically and even emotionally. And then single parenting can be seen in different ways, like either single parenting by choice, like mother decides I want to lead my child on my own, or can be the parents gets divorced, like mother and parents are aparted, so the child has to stay either with the mother or the father. And the third type is if the father is working in the different place, so mother has to take care of the child alone, and that is the third type. And the fourth type is if the father is dead or the mother is dead, the parents who is remaining has to take care of the child. These are the causes which are seen in the single parenting, and this generally affects the child a lot. Emotionally she might be lacking the care of either mothers or the father. Emotionally she will be lacking the care. Teenage pregnancy can be seen either in the culture aspects or in the social aspects. Like culture aspects in the sense, generally in few cultures, women's are like, girls around 13 years are being married. 13-year, a girl itself a child, she needs to grow, she is not mature enough to become a mother, either mentally or physically, both the way. At that age, if she is getting married and she is getting pregnant, that's not the correct thing. It will affect her physiological aspects, and even it affects her mental aspects. This is all because of the social and culture aspects. Next, sexual violence. If the woman gets raped or sexually assaulted, she doesn't feel like living anymore, she wants to die. The first thing she thinks is like how she's going to face the society. Or so these are the psychological, social and cultural aspects of pregnancy. These are the expected questions from unit 3 and unit 4. Again, I'm saying this is not the perfect question, it's just the question which are expected from this chapter. Do practice it, it will be very useful. That's it for today, guys. We will meet in the next video. Until then, stay tuned.